Hey, welcome back. My name's Tim Smith, and in today's video, we're going to be going over the two most popular Medicare plans going into 2025 and exactly how they work. But before we do that, I believe it's important to know that you have to have Part A and Part B of Medicare in order to get either one of these plans. Now, Part A, if you don't know, most seniors pay $0 a month for because you or your spouse worked 40 quarters or 10 years. Part B, on the other hand, projected for 2025, is looking like the average senior will pay about $185 a month for Medicare Part B. Now, those two together, to not make it complicated, are roughly going to pay about 80% of all your medical and hospital bills. So this is what they call original Medicare or traditional Medicare. So you do have to have Part A and Part B to get these two types of plans that we're about to talk about. Now, as you guys know, Medicare Supplement Plan G was the most popular plan in 2024, and that's not going to change. So that is going to be the most popular option moving into 2025. So if we're looking at the two most popular plans, we'll look at Plan G first. Plan G is what they call a Medicare supplement, meaning you can go to any doctor, any facility in the country that accepts Medicare. And so that's why it's so popular, is that there's so much freedom when it comes to choosing doctors, choosing hospitals. But this is what you can expect if you take out a Medicare Supplement Plan G moving into 2025. So what we're gonna see is typically the premiums are gonna be around $140 to $300 a month, depending on where you live. Now, when they release the rate increases for next year, I think you're gonna see these numbers go up just a little bit, but this is the average price range for a Medicare Supplement Plan G, depending on where you live. But how it's gonna work is you're gonna pay this premium every single month, but then you're gonna have 100% coverage no matter what happens to you. So what this Supplement Plan G is going to do is it's going to come in and it's going to pay this other 20% that Part A and Part B does not pay. And so you have 100% coverage after a one-time a year deductible, which this year in 24 was $240. For next year, they have not released that yet, but I would expect for it to go to about $250, $255 for the whole year annual deductible. Now, like we said before, you're also not going to have any networks. So you won't have any doctor or hospital networks. So as long as your doctor or your hospital accepts Medicare, you can go to any doctor or hospital in the country that accepts Medicare. It doesn't matter if it's an AARP Medicare supplement or an Aetna or a Humana, the carrier does not matter. Because when it comes to these Medicare supplement plans, all the carriers, all they get to decide to do is how much they charge for their plan and how much they raise or lower the rates every single year. Medicare actually administrates what these Plan Gs cover. Now, if you end up going the Medicare Supplement Plan G route, there are a few things that you're gonna wanna know. So it's not gonna include any drug coverage, so you will have to go out and get a separate prescription drug plan to cover your medications, which is definitely changing in 2025. So all these plans are moving to what they call a $2,000 drug cap, meaning that you, as long as you get on a plan that has your medications covered and in the formulary, you're gonna have a $2,000 max out of pocket essentially. So you can't spend more than $2,000 on your medications as long as they're covered by the plan. But I tell everybody on these to budget about $10 to $30 a month, depending on what medications that you're on. Now, in a lot of cases, if you're not on any medications, there are $0 prescription drug plans out there that you can take advantage of. But the average person pays about $10 to $30 a month for their drug plan. Now, it's also important to know that the Plan G does not cover any extras. So no dental, no vision, no hearing coverage. So you will have to go out and get a separate dental, vision, and hearing plan to have those services covered as well. And so this is the most popular setup moving into 2025. Now, I tell everybody with the dental, vision, and hearing, you should budget about $25 to $50 more per month. So what this is going to cover, it's going to cover a certain amount of money for dental every year. They start at about $1,000 and they go up to $5,000 of dental coverage. And then it's going to have a vision and hearing benefit built in. A really good company that I prefer on the dental, vision, and hearing is a company called Cigna, C-I-G-N-A. They have a really great program for dental, vision, and hearing. And if you're coming off prior dental coverage, they'll actually waive a lot of the waiting periods, so you don't have to wait to get the coverage that you need. But now let's take a look at the second most popular option moving into 2025 of how to cover this 20% that A and B doesn't cover. So your second most popular option you're gonna see is what they call Medicare Advantage. Now with Medicare Advantage plans, they are gonna look a lot different in 2025 than what they did right now. You'll see some similarities, but there's gonna be a lot of differences as well. So with the Medicare Advantage plan, when you take one out, you typically do not refer to Part A and Part B anymore. And so what that looks like is instead of you paying 80%, you're gonna just pay according to your plan. And you're gonna see that here in just a second. But if you take out a Medicare Advantage plan in 2025, you can typically still expect to have a $0 premium. Most of the Medicare Advantage plans that are worth looking at have a $0 premium, meaning you're not gonna have to pay anything to have the plan. But instead of paying this 20%, this Medicare Advantage plan is now gonna have certain copays that you refer to when you get things done. So you may have a $15 specialist copay or a $200 surgery copay, or one of your most highest copays is most likely going to be in the hospital. So staying in the hospital, you may pay $300 a day up to 5 nights. But you get the point. Instead of paying this 20%, you're going to pay copays as you go and as you use your plan. Now with Medicare Advantage in 2025, you are still going to have to stay in network. So these are network plans, meaning you can't just go to any doctor, any facility in the country that accepts Medicare, like on a Plan G. There are certain doctor and hospital networks that you have to stay within. Now they have 2 different doctor networks. The first one is what they call a PPO, a Preferred Provider Organization Network. Fancy word of saying, hey, if you go in network, you're totally fine, you're gonna be covered. But if you go out of network, you're still covered, but you're gonna have to pay a higher cost. So you're still gonna wanna stay in network. The second type of network is what they call an HMO, a Health Maintenance Organization Network. And what that means is you go in network, you're totally fine, just like the PPO. But if you go out of network, you're not gonna have any coverage unless it's an emergency. But both options, you're gonna wanna stay in network as much as possible. Now also what you're gonna see with a Medicare Advantage plan is that it has built-in drug coverage at no extra cost typically. So you don't have to go out and get a separate drug plan to cover your medications. It's gonna come built in to the Medicare Advantage plan at $0 cost. Now it's also going to apply to that $2,000 cap that we talked about on the prescription drug plan side. You're gonna have a $2,000 max out of pocket or cap for all the medications that are covered with that drug program. And so you can save a lot of money if you're on a lot of medications that are very expensive by finding one that covers all of them. Now, it's also going to come with built-in extra benefits, so dental, vision, and hearing coverage at no extra cost. So you're going to have a certain amount of money for dental, a certain amount of money for vision, and hearing coverage automatically built into your plan, most likely. And then lastly, Medicare Advantage plans in 2025, they have what they call a MOOP, or a maximum out of pocket. Now these maximum out of pockets are planning on raising for the most part nationally moving into 2025, but the average one is anywhere from $1,000 up to $8,000 or $9,000, $10,000 a year. So it really depends on where you live if Medicare Advantage plans are competitive enough to consider. And since you're still watching this video, I want to throw a quick bonus tip in. So there's a plan that's becoming more and more popular each and every year that you can attach to a Medicare Advantage plan that's going to pay for a lot of your copays and it's going to pay for a lot of your out-of-pocket expenses. Now what they call this is a hospital indemnity plan. And what this plan does is, like I just said, it'll come in and it'll pay for some of your most expensive copays. So what it'll do is it'll come in and it'll pick up, say, your 5-night stay in the hospital copay. Instead of you paying $2,000 out of your own pocket, this hospital indemnity plan will pay for it. Instead of you paying $300 for your surgery, this hospital indemnity plan will come in and pay for it, or your emergency room, or your ambulance ride, or you can set it up for a lot of different things. But this will come in and pay for the most of the biggest copays that you have, and it only costs roughly about $30 to $40 more per month. So it makes it a very great option to pair with your Medicare Advantage plan. Now guys, moving into 2025, Medicare has a lot of changes, as you can see, but I want to hear in the comment section below, do you prefer Medicare Plan G with a dental, vision, and hearing and a drug plan? Or do you prefer a Medicare Advantage plan? And what are your thoughts on this hospital indemnity plan? Do you like it? Do you not like it? Leave a comment down below. Let me know. Don't forget to like, comment, and subscribe, and I'll see you guys in the next video.